So he said, my bones in my ear have fused together and that's why I can't hear. So I wear hearing aids. So I've just had a patient who came for his routine wax removal with myself, and we've done that today. The wax removal wasn't too difficult at all. He's got very, very dry ears though, and that's just symptomatic across the skin of his body. So I've given him some advice about that. He wears hearing aids, and he's wearing very, very powerful hearing aids actually. So what we would consider to be the superpower or ultra power range of hearing aids. So and he gave me a little bit of his history. He said he's been assessed previously for cochlear implants, and he was told that the reason he couldn't have a cochlear implant is because his hearing is too good for that, which he didn't really understand. Additionally, he's never really been seen by ear, nose, and throat. In a consultant, he's only been seen in audiology, and in audiology, he's been given these two hearing aids, and he's wondering whether he can actually have a BAHA, which is a bone anchored hearing aid, and it's a hearing aid basically that is fitted just on your mastoid bone, just behind your ear. And what the benefit of a BAHA is, if your hearing loss is coming from the outer or the middle ear, as would be the case with him, because he's explaining the fact that he's got this fusion of the bone. So the middle ear has three bones: the malleus, the incus, and the stapes. And these three bones normally they have an approximation of movement that allows them to leverage sound from the eardrum into the inner ear. And sometimes they become fixated, and the most common form of that is called otosclerosis, where you get these calcium deposits that form over that bone and those joints, and they fixate the joints. The most common form of it is on the stapes and the link between the stapes and the cochlear. And there's a surgery that can be done in ear, nose, and throat to replace the stapes footplate in order to give back that movement, and usually it resolves the hearing loss that emanates from it. So in his case, I mean, he was describing the fact that he's got these fusion of bone. So I can't comment on that without knowing more information. But it sounds like, so he's fairly adamant that his hearing loss is coming from the middle ear. And he said, my inner ear, however, is really good. Now, the reason I'm surprised about that is because middle ear problems and outer ear problems, called conductive hearing losses, don't normally give rise to profound hearing losses. They would normally have a hearing loss. The maximum usually we would say is about 60 decibels. So if your inner ear is working normally or at a mild level, the most you'd expect for a really significant conductive hearing loss would be at about the severe level. And I think that's correct, because he's wearing really powerful hearing aids. That's my next patient. If you can hear that bell.